time, and we will call to order this virtual seminar on practical resources on how to check for validated blood pressure devices. Thank you once again for your presence and for being here on time. Let us look into some important details, information details. We have simultaneous interpretation into Spanish and into English, and we will be using both languages. We have different speakers using both languages. And when you're connected to Zoom, you can find the interpretation globe all the way to the bottom. And when you use your cursor all the way to the bottom, you can see the interpretation option app. You can click on the globe and select the language of your choice, English or Spanish. If you prefer not to have the original sound, the floor, you can click on the mute original audio button. For those of you who are following this meeting, if you have any questions for the panelists, please use the Q&A. This is an option that you have also all the way to the bottom of the screen in the bottom bar. And for the panelists, please keep your mics muted throughout all presentations. If for whatever reason you forget to unmute the mic or mute the mic, the host will activate it and activate it whenever needed. So let us formally begin this seminar. And for that, I give the floor to Dr. Pedro Ordóñez, Regional Advisor to Chronic Diseases, Non-Communicable Disease, PAHO, PAHO, WHO in Washington, D.C. Thank you, Jenny. Good morning, colleagues. My name is Pedro Ordóñez, and I'm responsible for coordinating all activities that have to do with the implementation of the HEARTS project. You know that this is the flagship program for prevention and control of cardiovascular diseases in PAHO. And today, the program that we have is devoted to one of the most important issues of our initiative. In fact, it is one of the main pillars of our initiative. And for that, it is a pleasure today to share this webinar with our colleagues from the CDC, the Center for Disease Control in the U.S., headquartered in Atlanta, and the Pan American Health Organization. And we're both pleased to bring to you this webinar of our series of webinars, HEARTS. I'd like to welcome now, we have 250 participants. We see that these 250 people have joined this webinar. And we also have Dr. Dean Picone from the University of Tasmania, really far away from here. So it might be the end of the day. We're waking up early in the morning in Washington. There he might be facing the end of the day. And we also have Dr. Cynthia Lombardi and our colleagues Jenny Rodriguez, who will be presenting the resources that HEARTS is making available to countries. And the best preamble in order to kick off this webinar might be sharing with you a video that you might have seen on the HEARTS webpage and in the different networks done by Mark Chaffee. This was done, it was a video when Mark Chaffee was the vice president of RISO to Save Life, one of our partners and one of our main donors in the HEARTS initiative. And it is a video that informs us about the importance of using automatic equipment validated devices to measure blood pressures. So this is a video that would like to show as the first thing in order to give way to the main speaker today, who's Dr. Dean Picone from Tasmania University. So I ask our colleagues from the communications department of PAHO, there are producers, the IT team for this webinar, to please show the video. This is by Dr. Mark Chaffee, so please show the video.
Vamos a ver cómo nos funciona esto, porque esto es todo un experimento.
Let me see if it works. This is a whole experiment. This thing about having virtual transmissions, all the way doing it here. But I can tell that this is going to be really good because the CMU team, PAHO's team, has worked on this. These are people that have worked hard in order to have this webinar. So please show the video. Unfortunately, we're not getting any audio, so we cannot hear the sound. We're not getting the sound. We cannot hear what Dr. Jaffe is saying. Please, if you can stop the video for a minute.
Algo nos está pasando, pero tranquilos.
Something is happening, but I ask you to please bear with us. We have 269 participants. They're slowly coming in and joining the webinar. So this means that the webinar has attracted the attention of several people, both from our hearts members, our countries, as well as other countries in the region. We also have our CDC colleagues connected. They've sent a message to their networks. And after Dr. Jaffe, we will introduce Dr. Patricia Richter. Patricia Richter, who is the head
Protección global a la salud.
of Global Protection for Health. She's the Global Non-Communicable Diseases Branch Chief at the CDC. So let's see if we're lucky and we can show the video. This is a live broadcast, and now we can hear the video. So please.
I'm Dr. Mark Jaffe. I've spent 25 years treating patients for hypertension at Kaiser Permanente, where we improved blood pressure control rates from 44% to 90%. I want to share with you why it's so important to use an automated digital blood pressure monitor. To increase control of high blood pressure, we need to make sure hypertension care happens where most patients get treatment, and that's in the primary care setting. To take blood pressure with the manual device, you need to do many things at once. Use your fingers to control the deflation rate, use your eyes to read a small dial or a mercury column, and use your ears to listen for the sound of blood passing through the artery. Doing this right takes a lot of training, and even experienced staff make mistakes. Now, an automated digital monitor does all the difficult stuff for you. It inflates to the proper pressure, and it deflates at the right speed. It displays the numbers on an easy-to-read screen, and it doesn't require any listening. As long as you get a monitor that's validated, you can be confident that it will be accurate. Since an automated device is simple to use, training is easier and faster. That means healthcare workers can pay more attention to things like positioning the patient. Specialists might use other ways to measure blood pressure, but for primary care, automated digital monitors are the way to go. Hypertension treatment programs have saved many lives already, and automated digital blood pressure monitors can help save millions more.
Bueno, excelente comienzo.
Excellent beginning. Excellent way to kick off the webinar. And now we can move more the participants with the presence of Dr. Jaffe and also with the music that we had in the background so that we could wake up this morning, those of us that we're on this corner of the world. I'd like to introduce Dr. Patricia Richter. As I said, she's the head Global Non-Communicable Diseases Branch Chief at the CDC. And these are our co-coordinators of this webinar. So Dr. Richter, please, you have the floor.
Doctora Richter, por favor.
Dr. Richter, please. We cannot hear you.
Doctora Patricia Richter, por favor.
Dr. Patricia Richter, please.
Parece que el micrófono de Patricia está como cerrado.
It seems that her mic is not working. Could you please activate her microphone?
Nuestro equipo de comunicación, por favor, con la doctora
Our
Patricia.
IT team, please, could we get in touch with Dr. Patricia? Dr. Ordóñez, Dr. Patricia was not able to connect. She sent a message saying that her computer does not accept the platform and that she was going to use a telephone. And therefore, there's no way we can activate her mic. She's not connected to the platform. So what do you think? What should we do? Well, we were not told ahead about this. We apologize, but we were not informed in advance that she was not able to communicate. Okay, I understand, and we will try in the course of this broadcast to go back to Dr. Patricia Richter. But since we're facing this difficulty, let us try to solve this immediately. And Dr. Dean Picon is ready to make his presentation. So I ask our colleagues who are organizing the webinar that we move to the presentation by Dr. Dean Picone. And then at some point, we can go to Dr. Richter. We can go back to her because Patricia was really willing to participate and to greet the participants. We organized this webinar together with the CDC. And in fact, they've been co-sponsoring not only the webinar, but also the work of Dr. Picone in a much more strategic and much more general piece of work. So without further ado, I'd like to introduce Dr. Dean Picone. Dean, welcome to the Americas from such a far distance. Thank you for participating. Thank you for your cooperation, and greetings to your colleagues at the University of Tasmania in Australia. So please, Dean.
Thank you very much, Pedro. It's fantastic to be with you. Now, do I need to share my screen, or are the slides going to be coming up for me? I can share my screen if that works. Just one moment.
Okay.
Oh, here we go.
Yeah. Go ahead,
Great.
Go ahead, Dean, please.
Thank you. So I can control this. So next slide, please. And so today I'm going to talk about the Valid Blood Pressure Project, which, as Pedro said, has been funded by the CDC, and we've been working on this throughout the year. So this work's led by Professor James Sharman, who is also from the University of Tasmania in Australia. And so today I'm just going to briefly talk about the background of the project, and then briefly about what we're doing with this project. And also I want to spend a lot of time on some practical resources that we've developed related to validated blood pressure devices. Next slide, please. Next slide. So high blood pressure is a leading risk factor for death and disability. It's responsible for around 10 million deaths per year. And it's a major issue that affects all corners of the world. So this plot here, what this shows, on the y-axis, we've got the prevalence of raised blood pressure. So moving up the axis, higher prevalence of raised blood pressure. And along the x-axis, you can see GDP per capita. So higher income countries are to the right of this plot. So you can see that in the, and each of these dots represents a country, and the size of the dot is simply the population of that country. So what you can see is in the year 1976, the prevalence of raised blood pressure was very much higher in high income countries. But if we start the video, if you just click the slide, please. So what you can see is that through the years, this situation has completely shifted. So up to 2015, the situation is that more of there's a higher prevalence of raised blood pressure in the lower income countries. So this really highlights that this is an important issue worldwide. Next slide, please. And so in 2016, the Lancet Commission on Hypertension was brought together, and they published this document. And the aim of this was to identify key actions that could improve the global situation related to blood pressure, to improve control of hypertension around the world. And so they came up with 10 key actions. And if you click next, please. The one that I'm going to be focusing on today is measurement quality, and in particular, validated blood pressure monitors. Next slide, please. So I just want to give you some background about what is validation and why is it important. So before I get into that, I just want to highlight this, this quote from Sir Thomas Pickering from a paper from 2005. It says that blood pressure measurement is one of the most important tests in all of clinical medicine. Now, we know this because it's it's a highly prevalent condition, and it's related to many deaths worldwide, but it's still one of the most inaccurate measurements as well. Next slide, please. So, as I think Pedro mentioned in the introduction, we saw the video as well, automated devices are being increasingly recommended where possible. So originally, since the early 1900s, we've used these manual blood pressure measurements, which you can see on the left here. That's a mercury auscultation with the stethoscope, or there are also aneroid devices, but the thing with the aneroid devices is that they typically need to be calibrated every 3 to 6 months to make sure they stay accurate. So that's why automated devices are a bit more stable, and there's an increasing move towards them for a number of reasons that we saw in the video. Next slide, please. And so but one of the fundamental things we need to do is to check that automatic devices give blood pressures that are equivalent to the manual methods that we use. So what automated devices do is they use algorithms to simply estimate systolic and diastolic blood pressure, and they are meant to be equivalent to the manual method. But there's no way of actually knowing that without testing it. So if we go to the next slide, see the question mark. So we need to understand this. And this is the purpose of doing a validation study, to check that the measurements from the automatic device are equivalent to the manual. So when we do a validation study, we need to follow a specific internationally accepted protocol. Now, these are all converging towards the ISO 2018 protocol, so there'll be one international protocol. There are still several that are being accepted at the moment that have been used over the last 20 to 30 or even 40 years as validation protocols, but for soon there will be just the one internationally accepted validation protocol. We need to do the test independent of the manufacturer of a monitor because that's a conflict of interest. The specific accuracy criteria that are set out by the protocol must be met or exceeded. Ideally, the results will be published in a peer-reviewed journal. And finally, a monitor that meets all these accuracy criteria is said to be validated. So when I'm talking about validated blood pressure devices, that's what I mean. These devices have gone through this process. Next slide, please. So why is validation crucial? Well, it's because non-validated devices are more likely to be inaccurate. An inaccurate measurement of blood pressure can lead to inappropriate management of blood pressure, either through underestimation of blood pressure where true risk may not be appropriately identified, or overestimation where blood pressure is identified as higher than it actually is. Next slide, please. And it's really good. We're all on the same page. Worldwide, international organisations recommend the use of validated blood pressure devices. You can see the WHO document, which was published earlier this year, the Lancet Commission Group Position Statement, and the PAHO resource, which is an excellent resource from the website, and the Hearts area on blood pressure measurement. And you can also see, if we click the next button, a whole number of societies from around the world recommend the use of validated devices. Next slide, please. But a key issue is that non-validated devices are highly prevalent worldwide, and this is a major problem. Next slide, please. So if they're using data from Medival, which has one of the largest repositories of blood pressure monitors, both validated and non-validated worldwide, so a record of all these devices. For every 2 validated devices, there are 9 non-validated devices. So you can see that the market is there's a huge number of non-validated devices. Next slide, please. So what's being done to improve this this situation? So the Lancet Commission on Hypertension Group, work led by Professor James Sharman, they published this document earlier this year. It was kindly translated to Spanish and I think Portuguese by Pedro and Gloria, which is fantastic. So the links are here, and I'm happy to share these slides with anyone who wants them later, so you've got access to all these documents. And the aim of this position statement was, next slide please, is to both summarise the current situation regarding regulatory requirements and accuracy standards for blood pressure measuring devices. So taking the first steps towards understanding the situation. And they propose that there should be a regulatory requirement for mandatory independent validation of blood pressure devices according to the new ISO standards, so the 2018 standard. Development of validation standards for new blood pressure technology. So this is things like wrist cuff or wrist-based wearables, where there's these are sort of new emerging technologies. And finally, online lists of accurate devices that are accessible to consumers and health professionals. So I'm really going to focus on this for the rest of the talk, this third point. Next slide, please. So the ValidB project, as I said, it's chaired by Professor James Sharman. The overarching purpose really is to increase the availability of validated blood pressure devices globally through advocacy and education. So there's a wide range of programs that are being undertaken under this ValidBP project. I'm really going to focus in on something that I've been working on in the last, since the start of the year, and this has been funded by the CDC through a grant that Professor Sharman received. And so it's been really fantastic to have the opportunity to present this to you today and share these practical resources that will hopefully be useful for you. So next slide, please. So what we tried to do is, whilst there's been I've mentioned that all these societies say that we should use validated blood pressure devices, and we must, if we're going to use an automatic device, it must be validated. How do we actually identify a validated blood pressure device? If we go to the next slide, please. Oh, sorry, next slide. I might come back to that. So what we can see is we've got very similar appearing devices, both validated and non-validated. There's not much difference between these. And when someone who's looking to buy a device goes to a shop or looks online, it can often be hard to tell. There's not much reliable information on the actual validation status of a device. So what we have done is create these resources to try and give a step-by-step guide as to how you can identify if a device that you might be looking to purchase or use in clinical practice is validated for accuracy. Next slide, please. And so we've developed this 3-page resource. It's been translated to a number of different languages. So this is the English page. Now, whilst it looks a bit dense, this is because we're trying to cover the entire sort of worldwide situation. So there are currently a number of different validated device listings. So these are online free registries which list blood pressure devices that have been validated for accuracy. And so what we wanted to do with this document, next slide please, is create a document that's relevant to anyone that's seeking to purchase a home, clinic or ambulatory monitor, including individual consumers, those procuring monitors for use in healthcare systems, and also retailers that might be wanting to only stock and sell validated blood pressure devices. Next slide, please. So we provide a bit more detail on the second and third pages of the infographic, which are specific to two registries which are regarded as more international or general registries that should be able to be used from anywhere in the world. So one of these is the STRIDE-BP registry, which you may have heard of. It's run from Europe, from a group in Greece. And what we've done here is give a step-by-step guide on exactly how to use the STRIDE registry. So if you download the document, which you can do shortly, you'll be able to click on the link there, which takes you directly to the website, and then you type in the model number of the device, and then you can see if it comes up on the web page, whether it's been validated or not. And there's a few handy tips on using that registry. And then the other registry is the Medival registry. So that's the one that I mentioned earlier, which contains both validated and non-validated devices. And we've got the step-by-step guide on how to use that, which is a bit different to the STRIDE registry. Each registry has its own strengths and limitations. So we've tried to give an overarching picture of all of these. Next slide, please. And we've also currently got a document under review at the Journal of Clinical Hypertension, which essentially describes these practical resources in a bit more detail. And next slide, please. So again, that's just highlighting the aims of the paper. Next slide, please. And it's currently under review. There's plans to have this open access so everyone can access it, and also hopefully we can get it translated to Spanish and Portuguese. And you can see here a list. We've got these this practical guide translated into a number of different languages. We're trying to make it as accessible to people as possible all around the world. Next slide, please. So these are just a couple pictures of the Spanish and the Portuguese, if we go to the next slide, which have been kindly translated by Pedro and Cynthia, which is very much appreciated. And you can download these resources either using the QR code here or the links, which I can provide to everyone later. And yeah, I would really appreciate as much feedback as possible on these. What works well, what could be improved, what other information or resources would be valuable to identify validated blood pressure devices, particularly in the Americas, because I'm all the way on the other side of the world, so I'm not on the ground there. So we would be really grateful to understand what works, what doesn't, how we can assist you identify validated blood pressure devices. And so with that, I'd like to say thank you very much for your attention, and I'm happy to take any questions.
Thanks to you, Dean. Well, now we have a few minutes for the next sessions. We have Q&A, few minutes for Q&A, questions and answer. So if you have any questions, just remember to go to the Q&A menu and write your questions. We'll be happy to answer. Pedro, I don't know if you want to say something before we started.
Yeah, yo creo, Jenny, que primero,
Yes, Jenny, I think, first
muchas gracias,
of all,
Dr. Picón,
thank you very much, Dr.
por
Picón,
ilustrarnos los
for
caminos.
showing
Dean,
us
esto pareciera para
different
un
ways
experto
to
como
go.
tú relativamente fácil
Yes,
encontrar el camino, pero ya sabemos que no lo es.
Simple to think that the
De hecho,
road is easy to find, but when
cuando hablamos con nuestros ministerios de salud, y
when we talk with our
entonces
ministries of
ellos
health,
preguntan, una de las
they
preguntas
usually
frecuentes
ask
es
us,
¿cómo pueden conseguir la lista
can
de
we
manómetros
find
validados?
a
Así que este
list
instrumento
of validated
que
devices?
tú has
So
estado
this
coordinando
instrument that you
será
have
de
been
mucha
coordinating will
importancia
be
y mucha
extremely
utilidad
important
para los
and very
países de la región.
useful to us
Y
and to the
también creo
countries
que
of the
para todo el
region.
mundo, ¿no?
And I think for
El tema viene
everybody,
por ahí. Y
because
el otro tema,
that's how it is.
mucho más complicado
And
es para los
the
consumidores.
other thing is that, but for consumers,
Porque en
for
la mayoría
users,
de los
it's a
países,
lot
cuando usted
harder,
va a la
because in
farmacia,
most countries,
todavía
when
no
you go to
puede
the pharmacy,
identificar
you
fácilmente,
cannot
digamos, en la
easily
caja del manómetro que
identify
usted está
on the
comprando,
box of the
si ese es
device
un
you're
manómetro
buying,
que está
whether
siendo
it is a
validado o no.
device that has been validated or
Y
not.
entonces
So
la
the user
pregunta que hay sobre el
is
terreno,
having trouble. So the question
aún
out there on the
sabiendo
field is,
que no
even
tenemos
though
regulaciones suficientes
we
para
know
eso,
that we don't
Y a
have
eso lo
enough
veremos en la
regulation for that.
presentación
And
de la
we will
doctora
see
Cynthia
that
Lombardi un poco más
during
tarde.
Dr. Cynthia
Lo
Lombardi's
cierto es que la
presentation.
pregunta que
The
viene,
truth
y
is
me están
that the
haciendo
question
reiteradamente
is
aquí,
that people are
que
asking here
no
is,
no debería
shouldn't
ser
there
una
be,
obligación de las farmacias
shouldn't the
identificar
pharmacy
cuáles
be
son los
obligated to
manómetros que están
identify
validados
what are the
adecuadamente
devices that are
para medir
validated
la presión arterial?
appropriately
Te
for blood
paso esa
pressure
primera
monitoring?
pregunta,
So
doctor
that's
Picón.
my question, my first question, Dr. Picon. What can you say about that for users? How can users determine validation?
Yes, thanks very much, Pedro. I certainly agree that pharmacies that they should be giving that information easily, and this is not a problem unique to the Americas. This is a situation that we see in Australia as well, and we're currently trying to work with pharmacies in Australia to see how we can try to improve the situation here so that they are only selling validated blood pressure devices. That would be the optimum, or at least having some way that consumers can easily, or patients that are going to buy them, which is quite common in Australia, have a way for them to identify whether a device has been validated for accuracy or not. So I think there is definitely great need for tighter regulation of the sector, and certainly hopefully the use of this resource that we've developed will be helpful, but it is hard when you're ready to buy a product and you might be in the pharmacy there and then, and it's hard to make that decision straight away. Most people would have to go away and then check look at the resource and check it. So it would be nicer if there was better regulation of pharmacy, so that people can go there with confidence and know that they are purchasing a validated device. Yeah, I hope that answers your question.
Tenemos otras preguntas
Sí,
del público.
We have other questions. Yes, I think this is a topic that we need to discuss a little further. But there is a second point here. Perhaps the groups with the Lancet, PAHO, and different organizations who are working together, maybe, are we involving pharmacists? Maybe pharmacists should be also having greater awareness and greater participation in these kinds of initiatives. Don't you think so?
Yes, absolutely. I fully agree that would be great. And we've just been emailing today with some pharmacists in Australia. So I think that in Australia, they're a very, very important part of patient care, and people can go to the pharmacist and have a free blood pressure check in Australia. So I think we definitely need to be engaging with pharmacists and having them involved in this process, certainly.
Tenemos otras preguntas.
Voy a pasar el micrófono a mi colega Jenny.
I'm giving the floor now to my colleague, Jenny Rodriguez, who has now other questions, and I invite our colleagues. We have now 373 participants in our webinar. It's a large number, so it means that it is a topic that is of great interest to many. I think our countries want to be active, and I think we are creating this roadmap and this way in which people can have more information, more knowledge, and more awareness as to how we can progress in this topic, which is of great concern. I'm talking about hypertension, of course. Thank you, Pedro. There's a question here from Dominican Republic. What is the average lifetime of the validated devices? And when is it necessary to recalibrate a device, monitoring device?
So for an automated device, it's certainly longer than the aneroid devices, which need so they're the manual ones with the dial, they need checking every 3 to 6 months. Automated devices, you can wait, I think it's at least a year, even every 2 to 3 years. We get our research ones at our institute checked every year, and we do a static check of them. So that's just checking that all the component, the tubing hasn't been broken or frayed, that the pressure transducer, if it says it's reading 200, that it is reading 200. So it's a little bit different to a validation. There was a recent study from the United Kingdom which showed that validated devices are much more likely to stay properly calibrated for longer. So non-validated devices tended to fall out of accuracy faster, or fall out of not accuracy, but the specific components within the device started to become much more problematic or worse in terms of their static accuracy faster. And even the validated devices, I think it was after about 7 years, they started to lose some of their accuracy. But you also may start having problems with the cuffs fraying. There's a lot of different components to blood pressure devices that do need to be regularly checked to make sure that they're all functioning correctly, because if any part of it does start to become damaged, then that can lead to inaccurate measurements. I hope that answers the question.
Sí, muchas gracias, doctor Picón. Mira,
Thank you very much, Dr. Picón. Our colleague, Sonia Ortiz from our team, from the NCD team here on PAHO, is telling us that we have now 371 people who have joined the webinar. And we would like to say hello to colleagues in Mexico. We have a big contingent from Mexico, Ecuador, Chile, Peru, Venezuela, Brazil, Panama, and some that are from Malawi, from South Africa, so outside the region. So many people have been attracted to our webinar, and I am really impressed with the numbers. Dean, I have a question. You explained a little bit, but we can go back to this. Someone is asking, do you think there is an application, or do we have an application or an app to easily identify what are the monitors that are validated? And to go back to the instrument that you have been designing, maybe can an app come out of this resource? Thank you.
That's a great question. Thank you. And it's, as far as I'm aware, there are currently no applications that provide a simple list. It's certainly something that would be a wonderful resource, and I think it's something that should certainly be developed. Now, I guess one of the challenges with this whole situation at the moment is there are several different validated device listings. So it would be great if there was one universal listing that could cover all the devices in the world, and then we could have an application that would work everywhere in the world. At the moment, there's sort of different fragments. There's a United States listing, there's a British and Irish listing, there's one for Japan, and there's the Stride and Medival, which are sort of more worldwide, although looking at them, they're certainly still missing a number of devices. So they could perhaps develop an application, but sometimes you may need to search in 2 or 3 different validated device listings to be able to find a specific device, because one device listing might list the device and another one might not. So it is still a bit of a challenging space. But sorry, I digress slightly. An app that could be used would be absolutely fantastic.
Excelente, excelente. Muchísimas gracias. Mire,
Excellent. Thank you. All right. We have another comment here, and this is from Ecuador, from Ricardo Gancino. Ricardo Gancino, in addition to saying greetings, Dr. Picon, he also says there should be public policies regulating the entry and distribution of validated medical devices in order to guarantee appropriate monitoring on on the part of the population, and also establish technical criteria in order or before the devices can go out on the market. Yes, and that's what we've been saying. We need to have regulations so people don't have to go out and engage in a guessing game to know which is the best device to buy. And there's another comment also, Dean. We've seen this problem in many countries. When we don't have a list of validated devices or one single list, then prices are also all over the place. The diversity is huge. The same piece can cost 200, 100, or 300, or however many dollars, depending on the country. And so it is difficult and an extra challenge for people, even if they want to solve the problem, the, this is becoming an onus. Would you have some comment in this regard, the variety of prices, etc.? Would you have something to say in this regard, Dean?
Yes, thanks for that. Those questions. It's certainly, I think, to brief comment on the first one, the Lancet Commission document around regulation is a fantastic document that I'd encourage you to read. It really sets out what is currently required of devices in terms of regulation and where we need to get to. In terms of the pricing, I agree. It's there are a very diverse range of prices. Speaking from Australian experience, we did a study where we examined all the online devices that we could find that were available for purchase in Australia. So these were sold by online e-commerce companies, companies within Australia, and the diversity of prices was somewhere from about 10 Australian dollars through to several hundred Australian dollars. Now, not always for the same device, but when we were searching among different websites, even just within Australia for the same device, there was quite significant difference in the price. So I think perhaps one of the challenges is when big companies sell devices across multiple different countries, perhaps the pricing, depending on where the device is sourced from, may change. Different retailers, of course, will probably sell devices to different prices. I think it's certainly another challenge that needs to be looked at closely, because we want people to be able to have access to affordable, reliable blood pressure devices ultimately, and we certainly don't want non-validated devices being used that cost hundreds of dollars. That would be that's exactly what we don't want to happen. I hope that answers your question there.
muchísimas gracias, doctor Picón. Bueno, yo creo que
Thank you,
estamos...
Dr. Picon. I think we have, yes, lots of more questions indeed, and we are going to be answering them. We had some problems with the microphone of our colleague, Dr. Patricia Richter, who is from the Division of Global Health of the CDC. And she has been one of the promoters of this webinar, and she's been having trouble with her microphone, but it seems that her microphone is ready to go. So even though this was not as scheduled, we want to listen to Dr. Richter, so I will now acknowledge Dr. Patricia Richter.
Hello, Patricia. Wow. Alguien nos dijo que teníamos a Patricia
someone told us that Patricia was ready and that her microphone was ready, but I mean, I apologize for these glitches. We are not TV experts or anything like that, but it seems we continue to have problems with Dr. Richter's microphone, but then let us field some more questions for Dr. Picon. There are many comments. Well, some people are concluding, well, if it's so obvious that we should have good regulation, why don't we have it? And if we should be focusing on better validation for devices and having validated devices, why don't we have any of this? So why have been so slow? And now I am calling on Dr. Cynthia Lombardi, and she will give us an update to tell us what things we are doing so that we can follow Dr. Picon's advice. So Dr. Cynthia Lombardi, please.
Good morning, everyone. Good afternoon good evening to Dean. The slides, please. Okay, thank you. Next one, please. I'd like to start by mention two studies that were conducted by PAHO last year and this year to find out what's happening in HERTZ implementing countries in relation to the situation of blood pressure measuring devices. So we had first an exploratory short qualitative studies with physicians, nurses, managers of health programs. And then later, based on those results, surveys of representatives of health regulatory agencies in ministries of health, and also review of the documents sent by these representatives of the government. And the results, basically, the results of these two studies showing that there's a lack of awareness of the importance of accuracy validation. And linked to that, the lack of knowledge of the validation methodology. Basically, what is validation for accuracy? That's what Dean explained so well. So people, I mean, healthcare workers, or physicians, nurses, and managers of health programs, many of them are not aware and do not know how a validation study is conducted and what leads to. And another finding is the very weak regulatory frameworks, or non-existing. Basically, there's no regulation of blood pressure measuring devices, very few exceptions, and we're going to more detail about that. There's a high diversity of brands and models. This also Dr. Picon mentioned as the same that's happening in Australia and in other countries. So one can find any models online or even at the pharmacy at the corner. There are diverse procurement mechanisms to acquire blood pressure measuring devices for use in healthcare facilities. And I mean, it can be centralized, the federal government can buy, or the institution, the health area can buy, depending on the country, or even the health center have some money, goes to the pharmacy and buys. And so there is no data, except for few countries, there's no data on which devices that are being used in the health center. So we don't know what's being used. Not to talk about validate or not. We don't know even what type is automated or not. and the acquisition is affected by budgetary restrictions. So in many centers, I mean, there are very few devices, and quality is an issue. Next, please. Here we can see some of the results of this survey that was completed by representatives of health regulatory agencies and Ministry of Health. We can see that the countries, most of them, 10, have medical devices law. This will be the legal foundation for any regulation. So most countries have this foundation, but when it's about a specific regulation of blood pressure measuring devices, only 3 of those countries have. So they're all general, there's a general law, but the blood pressure measuring devices, which have very specific characteristics, they are not regulated, except for the 3 countries. And in only one, the validation is requisite for approval for registration and what's called pre-market approval. So it can be sold in that country, can be imported and sold in that country based on a validation for accuracy. So when colleagues are asking about the regulations, well, it's basically, it's not regulation. I'm not going to go into details about every aspect, but just to mention a few. For example, cuff size is regulated in 2 countries only. And cuff size is a very important issue because of obesity epidemics. Now, also the acquisition of device to be used in government-funded facilities is regulated in only 2 countries. So other countries are not regulated. They can have what's called fichas técnicas, but that specifies some of the characteristics, but most of them validation is not a part. So what you can see is that the market in Latin America and the Caribbean is not regulated, and the importers and distributors are allowed to register, advertise, sell devices that are not validated and therefore not accurate. An irony on this is that most, from what I saw with online research, and I believe Dr. Bicon saw this too, is they are advertised as accurate and precise, even if they have not been validated. Next slide, please. Here we can see data on, well, the results of the survey on data about the devices in a monitoring enforcement mechanism in these 13 countries that participate in HERS in the Americas. It's only 4 countries have information on what devices are being used in primary healthcare facilities. So as I mentioned before, basically, we don't know it's being used to measure blood pressure, despite the importance of this clinical exam. And also shows that there is an infrastructure for monitoring. Let's say if we have regulations, there is an infrastructure to monitor and enforce, because most countries have some agency that has been granted authority by law to enforce, to monitor, to apply sanctions to related to compliance with regulations. So we have that infrastructure, let's say, if the countries were to develop regulations. Next slide, please. So what is needed for, if we want to achieve exclusive use of validated blood pressure measuring device by 2025, which is the goal of HERS in the Americas initiative? What we will need to do? Some of these actions were already mentioned. the previous presentation and part of the Lancet Commission paper, but I'm going to list them here because this has been the base of our work at PAHO. One is we need to raise awareness of the importance of accurate blood pressure measurement and the relevance of clinical validation among professional societies, among policymakers, among health workers, among the managers of programs, for example, non-communicable disease programs. And this will lead to creation of demand for validated blood pressure measuring devices. Because then we can have, hopefully, someone going to a pharmacy saying, no, I want a validated device. We have to disseminate the mechanisms to check if the devices are validated. And these are the lists that, or these resources online that were mentioned that list the blood pressure devices that have already been validated for accuracy. And also there's instructions that are developed by Dean and the team at the University of Tasmania. So we have to share this, and these are already in the website, on our website. We have to strengthen capacity in the use of the ISO 2018 validation standard and create research groups and networks that can carry this validation in the countries. And we have, I think this is crucial, we have to develop, implement regulations that include clinical validation as a requisite for pre-market approval and registration. So only those devices will be sold in the country and imported, basically imported, because only 2 countries have a capacity to produce devices at this point, which are Cuba and Brazil, Brazil in a very limited way. The regulation must include also requirement of different cup sizes. They must include also the monitoring enforcement mechanisms dedicated budgets. So it's not only to have regulations, but that those agencies that I mentioned have the resources to go and enforce compliance with these regulations. And we have to have exclusive use of validated devices and government-funded facilities. We cannot be spending public money in inaccurate devices. The next slide, please. So what is PAHO sees as the next steps in this strategic area of work, which is the blood pressure measurement. Development of regional regulatory framework that could serve as a model for the countries to adapt or implement in their countries. The development of support of development of a regional list of validated devices, because now there are these international lists, and also some countries have national lists. But many of devices that are sold in Latin America, they have different names, different brands. They are not, it's very hard to find them in these lists that are available. So perhaps Latin America and the Caribbean need a regional list, or countries will need to develop national lists if they have the capacity. And also to provide technical support to countries on updating and developing regulations in the country basis. Next slide, please. And last, I would like to invite you to check our website that's here, and that have several resources, and we keep updating it with new resources or articles, and for example, with the Dean instrument that's going to be there also. Thank you very much for your time, and I would like to now to call Dr. Yanni Rodriguez, who is also part of our team at PAHO in Washington, D.C. for her presentation. Thank you.
Okay. Gracias, Cintia. Las presentaciones están, las diapositivas están en inglés.
Thank you, Cynthia. We have the slides in English, but we will have on the webpage the entire webinar recorded in English, in Spanish, and with the slides in the respective languages. Please, can we activate the camera?
Continuar.
Because of time limitations, I will continue. We will briefly take a look at what are the future tools or forthcoming resources that we have on blood pressure measurement, the resources, the tools available.
Actualmente tenemos disponible.
Currently, we have the course available. This is a course on update on hypertension and cardiovascular risk management in primary healthcare settings. And we are working in order to have the course available in the coming 2 to 3 weeks. And this is a completely new course that comes to replace the old course on blood pressure, on hypertension. We have 8 modules, and it will be available in the public health virtual campus of WHO PAHO 24 hours a day. You can take the course by a student, by any participant, then do it at your own pace. However, this is a course that has been designed specifically so that it can be taken in a training session one morning from 4 to 5 hours, and it comprises the most relevant modules that any member of a staff in primary health care must know in order to have a correct measurement of blood pressure, to diagnose a patient and to manage the patient in keeping with management protocols that we've been insisting on from the point of view of the organization and the work we do with the HeartSat team. And it also deals with the validated devices. Next. We are also working in order to make available the October 18th World Day on Hypertension on a course on accurate blood pressure measurement, which is an initiative taken by the Pan American Health Organization with the World Hypertension League, the World Hypertension League, and the Lancet Commission on Hypertension Group and Hypertension Canada, and within which we have a committee of experts that has developed a very brief guide, a management guide that includes very simple steps so that the person can be trained by measuring correctly blood pressure. So this is completely free of cost. You will get a certificate. 6 months is what this will last, because when the person takes the course, you will receive a certificate certifying that you're capable of accurately measuring the blood pressure. And this is something that we want to do because in the world, the failure that we have is in a wrong diagnosis of the blood pressure. And it is not only due to the fact that you don't have validated blood pressure devices, but that you're not using the correct technique for the measuring of the blood pressure. This course is designed so that we can have a correct mechanism in order to measure blood pressure in patients, and that all health professionals will have the capacity and the ability to quickly do this, but not only quickly, but accurately, to follow step by step all that is necessary, both in the preparation as well as in taking the blood pressure itself. And I believe that with this, we will conclude the theoretical part of the webinar. We would like to thank all the participants for their attention. We have been answering approximately 30 questions over the chat for each one of the participants. Most of the questions have to do with where they can find these, what are the devices that have been validated. We have 5 minutes at the most to answer a relevant question. And now I'd like to give the floor to my colleague, Dr. Pedro Ordóñez. Yes, Jenny, thank you very much for this presentation. We have a lot of things that are left unanswered, and this shows the interest that this topic has awakened in measuring blood pressure with validated devices. I'd like to insist on the importance of this issue, because the speakers have been explicitly describing this, that this is an important issue, that this is a critical issue. We have to pay attention to this. I invite you to visit the HEARTS website. We will have the resources there. There are a lot of resources that we have been creating in partnership with the CDC, with the VISO, with the Tasmania University, and these resources are available on PAHO's website. We have 374 participants, and you know that our CDC colleagues have had difficulties, but Dr. Patricia Richter has asked me to communicate to you the following. The CDC continues to work with all partners, including WHO and PAHO, the Pan American Health Organization, in order to assure the appropriate environment to study the economic impact and also to reduce mortality rates and premature disability because of non-communicable diseases. And for that, they have worked on the development of a body of evidence, scientific evidence, and also strengthening the capacity on the type of work, and in order to improve surveillance systems. This is what CDC is doing, Centers for Disease Control and Prevention in the US, and their activities are focusing on promoting and supporting in an innovative way interventions, evidence-based intervention for the prevention and control of these diseases. And as we know, the CDC has been developing and also supporting the implementation of the HEARTS technical package. In fact, the CDC paved the way for the region of the Americas some years ago, with the first countries that started implementing HEARTS. In the past, it was called differently, but ultimately these were programs in order to improve the control of hypertension through the consistent implementation of a group of key concepts, the standardization of treatment protocols, access to drugs and essential technologies. And this is one of the pillars, access to validated devices in order to measure blood pressure, and also access to essential drugs, teamwork, the monitoring system, as well as assessment system, advice in healthy lifestyles. And what we've learned today here can be enforced both in clinical offices as well as outside these clinical offices, and that it reiterates the importance of correctly measuring blood pressure. And she's very happy to contribute to this effort. The CDC is very happy to contribute to this effort through the Mises Institute for Medical Research in the University of Tasmania, and to our colleagues that, like Dr. Picon and Dr. Chapa, have developed a group of practical resources, both for consumers as well as for health institutions, so that they can identify and be able to purchase validated devices in order to measure blood pressure. So my colleague Patricia has had problems with her connection, but I'm greeting you on behalf of the CDC and thanking you all for your attention. I'd like to thank Dr. Picon once again for his participation in this webinar, and I'd like to close this. Dr. Picon, please address some last words to our participants, those who have been following us today, and thank you all for your attention. The communications team, IT team at PAHO, and our colleague Jenny Rodriguez, who coordinated this. So your final words for our participants, Dr. Dean. It seems to me that we need to organize another one because we have a lot of people interested in this and we have lots of questions. So I'll give you the floor so that you can formally close this webinar. Thank you very much.
Oh, well, thank you very much, Pedro. It's been an absolute honor for me to present at this webinar. It's been a fantastic experience, and I think this is probably the biggest audience I've ever presented to. Even though it's online, it's still a little bit, makes me a little bit nervous. I guess the key message from this webinar is please have a go at using the resources. We would love to hear your feedback. Please, I would be very grateful to you to email me, tell me what works in the Americas, what might not work so well, what can we improve? Would you like them in a different format? I've heard that an app would be really useful. This is a really important message about making sure we're using validated devices, because they're one thing that if we don't use them, we can get inaccurate blood pressure measurements. So hopefully this resource is useful, but we would love your feedback in particular. And so once again, thank you for the opportunity to present this work today. I really appreciate it. And thank you very much as well to the CDC for the funding to enable us to do this work.
Bueno, muchísimas gracias a todos. Gracias al doctor Picón.
Thank you very much, everyone. Thank you, Dr. Picón. Thank you all for participating. 375 people, 375 participants in this webinar. So I greet you. May you have a good day. Take care of yourselves. Stay safe. We're still in COVID-19, and that needs us to take care of our health and take care of our patients with chronic and non-chronic diseases. As you know, these are the main thing that we have to deal with, the patients with chronic diseases. Thank you very much and have a good day. Goodbye. See you next time.